Welcome to another episode of Negro Show. This is your host, George.
And I'm Adriana.
It is so good to have you guys with us again. Today, we have a super awesome, super duper great, interesting kind of episode. We have a great episode today. Our episode today is our first doctor visit. We're so excited. Café Negro Show is going to see the doctor today. Yes. So why don't you come and take this trip with us? Today, we have our special guest, Melody Santos. Dr. Santos, welcome to Café Negro Show. How are you doing today?
I'm doing good. I'm glad to be here and get to talk to you on your first official doctor visit, at least. Yeah. I hope you guys been going to the doctor a little more than this.
So, yeah, no, absolutely. No, you're correct. Well, personally, we have our own medical history, but this is the first visit for the Café Negro Show. Yes. We're so super excited and grateful that you made this time to be with us today.
Thank you.
Thank you for having me.
Yes. So, Dr. Santos, tell us a little bit about who you are. I mean, just tell us a little bit of who you are, maybe where you're from. Where you're at.
Sounds good. Consider myself to be from Tampa. So, vecino.
813. Tampa, wonderful.
Officially switched my number to 813, so yes, officially.
Beautiful.
But I went to college there at the University of Tampa, and then went to AUC, American University of the Caribbean, for med school in St. Martin. I did the first 2 years there, which is just a book work. And after that, during that, got hit by the hurricane and went to England. So I was fortunate enough to do some of the last 4 months of the first 2 years in England. So that was fun. And then I finished out. Yeah, it was interesting for sure. A free vacation sort of.
Yeah.
And then I went to New York and Long Island, and that's where I did my clinicals. Yeah, and I decided to do my residency in medicine, psychiatry combined. So it's a program that's about 5 years long. So you don't have to do the full. Medicine's usually 3 and psychiatry's 4. So if you decide to do them back to back, so that you're double board certified, it's usually it's about 7 years. So this just breaks it down a little more. So you don't have to do the whole 7. You get to do 5, just compacted.
Look at that. It sounds like you've been very busy indeed.
It's been fun.
So your specialty is psychiatry then? It's gonna be?
Both medicine, general medicine, and psychiatry.
Okay. Oh, okay.
That's wonderful.
Nice. Okay.
All right. Well, doctor, we're going to get straight to the questions. I'm sure everybody's excited to see what we got to talk about today. So I'm going to start with the first question, I believe. Or is it?
Okay, no, me.
That's right. That's your turn. Sorry.
All right. So Dr. Santos, where can I find information about medical tests or conditions, right? Which sites are trustworthy? And the reason, I thought this question was good was because, like every time somebody gets at least it happens to me and everybody that I know, gets diagnosed with something, they'll go to Google.
Or a symptom.
Yeah, or some symptom. Yeah, and they'll go to Google and you'll find like the most
the
scariest thing. So, as a doctor, like what, where can I find this like legitimate information or trustworthy information?
So for us, we usually go to this thing called Up to Date, but that you have to pay for. So for the easy, free version that I usually use before myself, one of my favorite ones is Medline Plus. And I believe that's Medline. Plus. I wrote it down around here. MedlinePlus.gov.
I'm going to write it down too. I like that.
Yes, that one. I wrote them down here because I didn't know they're full. Yeah, MedlinePlus.gov. So that one gives you a brief overview of diseases, symptoms, like if you had any injuries. It sometimes gives you like photographs of what things can look like, diseases and things. And it also gives you just illustrations of disease processes. And it breaks it down so you're able to consume it and have all the details that you don't necessarily
So it's understandable for like your average Joe that, doesn't necessarily understand the medical terms or something like that. So it's understandable. Yeah. And you said it's kind of a trustworthy resource.
Yes, that one I like. There's a couple more, and I'll just briefly tell you about them. So there's MedPage Today. So that one, depending if you just want to read about things. But if you're looking for information about yourself or things that you've been diagnosed with, Medline Plus. There's also another one that I really like how they explain diseases is Merck Manuals. And that one's Merck, MERCK manuals.com. Okay. And so those two I like a lot. And the last one that I really liked was Family Doctor. And I believe the APA, the American Academy of Family Physicians actually was the one that recommended that one. And that one breaks
Very
it down,
nice.
gives you some calculators that you can just calculate some basic stuff for yourself, like cholesterol or things like that. And the doctor talks to you about it. You can just look it up and put your numbers in, see what your risks are. So
Look
that
at
one's
that.
a good one.
Nice.
Wow,
Okay.
that is
That's one of my
super
favorite
great.
ones. Yeah.
Yes, and none of her suggestions were Google. So
This is true. This is true, which is what we normally go to because it's, I mean, even right now, if I were to say, hey, Google, I'm not going to say it loud because she's going to start talking back to me. But, because we have those audio in the house. But yeah, she tells you like the worst.
It's true.
Google,
or it'll take you to
Google's
Mayo,
scary.
which Mayo is a pretty good one too. But sometimes
I've
Mayo
heard about
gives you
that one.
yeah. It depends if
Yeah.
you're good about it. It gives you the information, but then it could throw you for a loophole. But if you go on Google and you search it, just look for what you're looking for under these websites. So just
Yes.
Google it and find that website.
That's great. All right. So we are going to go to question number 2. So question number 2, does taking medicine with food mean before, after, or during a meal? Because and I know, I don't know if it's just me. Like sometimes, I'm not that organized. So I'll eat my burger with the medicine at the same time. So, but I'm not sure if that's okay or what does that really mean?
So I love this question when I read it. I was like, that's a great question. Nobody really talks about it. They just say with food.
Yes.
So
my
I like
thought
this
was
question.
like we've always done it before. Well, I mean, I do it before, but I don't know if I'm right.
Well, sort of the timing. So it doesn't really matter for most medications if it's minutes before. I would say to give you a timeline, probably 5 to 10 minutes before, during, or 5 to 10 minutes afterwards, even up to half an hour, because your body takes some time to metabolize or break down most of these medications.
Yes.
But for the most part, for some of these medications, they hit the stomach a little different. So they might cause more acid to come out because their stomach needs to break down the medication, and then this acid sort of comes up. And so that's a lot of times what they're trying to stop, the acid reflux.
Okay.
But other than that, the short and the long answer is that technically no, as long as you're taking it within 10 to half an hour, 10 minutes to half an hour intervals, then it shouldn't matter. Where I would say that the timing of the medication matters the most is with your diabetic medication, that it should be taken just about as close to as you can with the food to reduce blood sugar levels after eating. And so you want to avoid having very low blood sugar levels after that. Maybe some enzyme supplements and things like that. But other than that, and especially if you're taking any aspirins and NSAIDs, take them as close as possible to eating food. And sometimes even taking them right after, just because you have that buffer of having a little bit of more food that the medicine now, the acid is also interacting with the food and the medicine. So that would be it. Other than that,
Okay. So yeah.
Yeah, but also just try it out.
So I'm okay with
Yeah.
so then I'm doing all right by taking the pill with the food at the same time.
Yeah, there's no problem with that. And if there was any
Sweet.
specific medication out there that it did matter, that they're not just saying in general, take it
Correct.
with food, they would tell you take it
But like
2
for
hours
OTC medications, I mean,
Yeah, this is really good information because, like, for instance, like my mom has like a couple of pills that she has to take with food, and she will take it 30 minutes before, and she's like, I cannot eat. Like, I'm so hungry, but I can't eat because I have to wait. So this is really good information that I'm gonna pass on for sure.
can't wait till you see this, Mom.
I would say the only one other medication that comes to mind now are certain mouthwashes for if you have some sort of any infection in the mouth or anything else that they're giving you mouthwashes for. It's just because you want that medication or that mouthwash to stay in your mouth for longer. Kind of like when you go to the dentist, they tell you not to eat for a period of time afterwards. So that would be another one that just came up.
That makes sense. Yeah.
You don't want to eat just so it interacts better.
Sweet deal. Thank you. That was a great answer.
Yeah.
Sure, I really like that question.
Yeah. On to the next.
Well, he really liked that question.
Oh my goodness.
And I really liked it when I told him, yeah, nobody ever thinks about that,
I mean,
so you see, she thought it was a good question.
That's true. Yeah, no. And then, I mean, the fact that it's true, like now that you were mentioning about your mom, that she does have that timing with the food, what
So it was
is
a good
that?
question.
Yeah.
That's the important thing. Anyways. Okay, so question number 3. So which health advice do you find it hard to follow?
This
This
is
is like
a
a
tough
personal
question for me. Yeah.
Because I have seen, working in the medical field, we have been with, coworkers that, in their lunchtime, go to the back and have a cigarette. And it's like, we work in a cancer institute. And, it's so I know that just because you're in the medical field and know what you're supposed to do, it's not necessarily that everybody follows it. So,
They say doctors are the worst patients. It is true. A lot of the times you'll see people with big Cokes and big Diet Cokes.
Yeah.
Or bringing donuts in, which I love, but still.
And especially in every doctor's office. I mean, the patients, especially around Christmas and the holidays, they bring a basket of cakes with extra sugar. And what do you say? No, I don't eat it. I mean, it's difficult.
So what would you say it's the hardest health advice for you to follow?
So this one was tough for me because I consider myself a little bit of a health nut. But I thought about it for a while, and I think besides drinking water, my fiance says I don't drink enough water. But besides that,
congratulations on your engagement.
Thank you.
That is awesome.
I appreciate it.
That's beautiful. Lucky guy.
I think so, at least.
Of course. Are you kidding me?
I'll make sure he listens to this. But
yes.
But the only thing besides that I could think of was that I love cheese. And cheese, for whatever reason, doesn't hit my stomach well. A lot of people, dairy doesn't. So for you as well. There you go. For me, it makes me break out. And so besides giving me like an upset stomach, it'll make me break out. And I can't stay away from cheese.
Is that like all types of cheeses or?
Yes, I love all types of cheeses.
Now, I know that if you're a cheese lover, I mean, I love cheese. So it's so difficult because, it's such an enjoyment and there's so much variety and it's a snack that you can just grab and go. It's too easy.
So what do you do to stay away from it? Like, how do you do it? And I
haven't figured that part out yet.
Usually if I'm alone, then if I'm living alone when I was in med school or now, I just won't buy it. That's how I stay away. And then if I'm going to eat it, like if I eat pizza or whatever, I eat it out. I usually don't eat it at home. Is what I try. But when my brother comes by and we're going to watch movies or something like that, always buying snacks, and cheese is the first one, unfortunately. But you know what? An interesting fact about cheese, which might be why I can't let go of it. There was a study that came out that said that milk, there's a product in milk, and I don't remember the specifics of it, but that it's as addicting as an opioid. And so that might be why there's some component in milk.
So that's why I'm lactose, but I'll do a bowl of cereal when I need it. And it's like, I know what's going to happen, but
it's the spot right there.
It's worth it. At that moment, it's worth it. So let's go to the next question. What are the most common health questions you get asked? Yeah, I think.
And that's kind of broad. So
I guess in your experience, I mean, so you're practicing in North Carolina right now?
Yes.
Okay, very good. So I guess it would be, considering where you're at, has something to do with it, or
a little bit maybe. I think that from the past 2 years, which besides being here for 2 weeks, I can tell you more about the past 2 clinical years. Yes. So those were in New York, and maybe a little bit of different population, but more or less the same. But some of the questions were, I feel like number one was how to lower my blood pressure. That was it. The number one every time. And then you would ask the patient, what are you eating? And they'd be eating arroz con gandules bien salado, like pork, all these salty things.
That's part of our religion, basically, like
pupusas,
Hispanics, it's hard.
Oh my goodness.
Yeah.
And so
I see that. No, I'm like trying to think that.
Well, I mean, obviously, as Latinos, that hits very close to home. If it's not us, we know somebody. We know a tío or papi or somebody, and mommy, that deal with high blood pressure, or diabetes is a popular one too, unfortunately.
Yep, diabetes is one of the big ones.
Yeah, because I mean, our traditional food is just a lot of
salty, and that's what makes it good.
And it's like, what is the word that Puerto Rican people say when it's not like flavorful?
So-so.
It's a so-so. So you don't want
100% true.
So.
I used to always tell the patients, though, start a little bit at a time, because there were some people that just wanted to, or they would tell you to your face that they were going to cut everything out, right? But they would come to the next visit and you're like, what did you eat this week? And I'm like, I ate my salad with what? Una chuleta. And I'm like, all right.
I have my salad in my burger, so make sure I have
See, it works. It's balanced. But I would tell them to start one thing at a time. Like if there were
Yeah.
I don't know if they were cooking with a lot of adobo, take out the adobo and start cooking with actual salt, so you see how much you're putting in there, or
That's good advice.
cut out like
Mm.
I don't know,
We're
just start one
trying.
thing at a time.
It's hard.
I've
Yeah.
actually, doctor, actually talking about that. I think I've lost like almost 15 pounds already.
Mhm.
Congratulations, that's
I
awesome.
know. Thank you. And it's we've been trying to substitute certain, and like
Mhm.
you said, not everything, because there's just, realistically, I'm gonna go in depression if I
Like
don't
at
have
least
a
like
meal.
3 times a week, like like we were eating a lot of rice,
Oh,
and
yes.
like not enough vegetables, or like
Correct.
we're trying to do better.
So
Yeah.
we've traded the rice for like string beans,
Okay,
some
that's really good.
we'll do a
Carrots,
salad,
the roasted carrots.
roasted carrots,
Yeah. they're good.
and then we'll still have rice, once a week, maybe a couple
Yeah.
times a week, but
And that's really good. Upping the vegetables as another thing, also besides the fact that it makes you fuller. So if you're overeating, that may be a good thing. But one of the things, especially with the diabetes, that eating cruciferous vegetables, or the ones high in fibers, is that fiber slows down the metabolism of the carbs and the sugars. And so the sugar's not getting to your blood as fast, so you're not having those spikes in sugar. And so if you're
Wow.
diabetic, that might be a helpful tip.
interesting.
Yes.
Just the thing is, you can't like overdress it with ranch or something. Isn't it?
No, what do you think about olive oil? I mean, is that,
I was just gonna say that my thing's like olive oil.
I like it. So here's the thing about me. I follow the Western side of medicine, but I like a little bit of that Eastern sort of naturopath side. And so even if you go towards the keto sort of
Yes.
diet thinking nowadays, and even if you don't, the fats are good. Certain kinds of fats are good in olive oil, avocado oil, healthy butters.
great
They're
to
pretty
hear.
good. So yeah,
Very
oil,
good.
vinegar. I've never been a vinegar person, but whatever
I like
works.
vinegar.
Yeah. No, she does some great carrots. It's with some olive oil. She puts actual real lemon, squeezes lemon on it instead of like the
Okay.
vinegar to give it that citrus.
Yeah. it's
And
really
what do you put? Garlic.
good. Like salt and pepper. It's like it's super easy. Like so
And then
good.
she bakes it,
Yeah.
and it comes out
So yeah,
incredible.
we
Carrots, you said?
Yeah, carrots, roasted carrots.
Okay.
We just like
And it's like a sweet, salty.
it's so good.
Yeah, it's
With
They're gonna ask you
garlic
soon for like a food episode where you're cooking.
oh yeah, we're thinking about that because that's something we do all the time. Yeah.
Okay.
That'll be a good one. But yeah, that's one of the ones they ask me the most. The other ones, like you said, about the diabetes or how to lower cholesterol. So it's a lot of or how many calories to eat in a day.
And that varies by like your size, right? Like your height and stuff. Like how do you
Yes, I tell most people you could do the calculation if
Yeah.
you want it by paper. But if you just Google caloric intake and calculator, you'll be able to find one. And just find one that you're putting your age, you're putting your weight, your sex. It usually asks you for your BMI and things like that, and then it'll spit a number at you. You don't need to be 100% within that, and then that's sort of your daily intake. So what if you're just having? You also put most of the time like your exercise level. So if you're exercise 5 times a week, then you
She
put that
does
in as
that.
well.
What is that? 5 times a week?
Yeah.
Which
try.
is, yeah. And I try to join her
But
as
he
much as I
doesn't.
can. But I
You're like twice. Every time, come on. And I'm like, invisible teammate.
I say because I'm always doing I'm always doing like the heavy lift. I'm always doing something. Yeah, that's
No
I'm trying to do outside or something.
See, that's what I get from my patients though as well. They're like,
Yes.
at work I put all the boxes up really high, so it doesn't count because your body's doing every day
So
the
you
same
see,
amount.
doctor, you got the both extremes here. She's
I like
very
it.
good, and in fact, so much so that she literally hasn't gained 1 pound since we've gotten married.
Well, except when I was
Wow.
pregnant. Yeah. Obviously.
A little bit of an exception.
Yeah.
Would that pass? But yes,
That's crazy.
because she's very disciplined. Yeah, sorry about that. So she's very disciplined when it comes to it. Like she can tell. She's like, oh my goodness, I feel like I definitely
My
went up a
jeans
little
are a
bit.
little tighter.
Yeah.
It's time to like ease off.
But she doesn't do no extreme diet. We've never done a diet in the house. She'll just like cut her portion, or maybe just miss rice for one meal. Very, very, very good. And then I try. I
You're
haven't gotten
getting
up
better
too
and a
much.
little
I'm
bit
getting a little
better.
better. Yeah. Plus, now with kids, I want to be able to play soccer with my son when he's 15.
And not be out of breath. Yeah.
And so,
That's
and
a big one.
so it really is motivating. It really is motivating. And that's why we're having our first doctor visit here at Cafe Negro Show.
But what Adriana's doing is really good, actually. I try to tell most patients that, don't go extreme. So if you're eating these things, just cut up a little bit, like we were saying, maybe add some vegetables, but don't go crazy like into this diet or the paleo diet or the keto diet if that's not what you like. For example, I tried the keto diet for some time, sort of where I wanted to see like what they say, all these things that it does to your brain or doesn't. And I just wanted to test it out. But for me, I love eating aguacate. I'm not a big rice eater, so I love my fats more than anything. So for the keto diet for me worked because that's what it's about. And so I tell patients, don't go crazy into one diet or the other. Just take things. And if you decide to try one, take what you like. Maybe in the keto, you decided you liked olive oil. So bring that back to your diet, to your daily lifestyle more than being on the strict, sort of blinds on each side. So that's a really good thing that you're doing.
Thank you. And now we're going to my favorite question. I can't wait.
Is this my question or your question? I have to ask this?
No, I have to ask you. What is my favorite one?
Oh my goodness. Yeah, this is
okay. So what advice would you give a hypochondriac? Okay. And I'm not saying any names, right? But yes, what advice would you give a hypochondriac? Yes.
All right. So I like this question because it brought the psych side, but what I heard from one of my attendings when I was in med school was to go read an article about the hypochondriac. And in this article was a hypochondriac herself talking about how she had a specific doctor, and he wasn't a psychologist or psychiatrist. He wasn't in the field particularly. He was probably like an orthopedic surgeon or something. It was something random. And it was an advice that he gave her. So that was my favorite advice. And I went back to look for it. I was searching for it for a while. But the advice that he gave her was to remember that her brain was just remembering the pain every time something came up. So for most people, something like you start getting a back pain, you start thinking, I have kidney stones, which could be, but I have kidney stones, or I have cancer in my back, or I have whatever it may be, however extreme you want to go. Or if you have a head pain, usually people go to cancer for the worst. But you could have I have X, Y, and Z. And so he was telling her, so you're getting this pain, maybe you did have something in the past, or maybe you just had regular headaches from stress, and now you're getting them again, and maybe you're not stressed, you're like, it's something else. He's like, just remember that it's your brain remembering the pain again. So maybe it's just it's throbbing in your back, and it's like, hey, you had this before, don't forget it. This is sort of how it feels like. And I really like that because it sort of talks about the power of the mind and convincing us of how we feel. And so if they say, if you say something, or if you believe it enough, like you can achieve it. And in the brain, it actually is sort of correct, because one thing I love about the Bible, it talks about, meditate in the Lord and sort of changing your thinking day to day. And in neurology, it actually, in your brain, there's actually connection. So it's sort of like an electrical circuit. And the more you think about something, the more wires you sort of put. So the more connections you're putting in that brain. So when I'm saying, I look good today, or you're talking positively about yourself, then you're making more connections on that side of the brain versus this side of the brain that's saying, I look bad, or I'm not good enough, or whatever it may be, or I have this disease. So if you're talking more towards the positive side, or even if towards the negative side, whichever way you're thinking about and you're meditating on, you're actually making physical connections in your brain.
It's making it real.
It's making it real. And then that makes it easier, because the same thing with like circuits, the more you have, or I don't know how electricity works, but usually the more you have, it's easier for the electricity to pass by. It's easier, it's faster. And so it sort of becomes automatic. And so the same thing in our brains at a chemical, really tiny level.
That's amazing.
So I thought that was pretty cool. It talks about, the power of the brain.
Yes. And I think also, going back to the first question, like, typically like people that have symptoms will go to Google, and then you see like the worst thing, so it's kind of like somebody that's already like thinking like, oh my God, I have this back pain for like 2 days now. And then you Google back pain, that's like, you have to go, like, you have to know where to go.
And I think it's great that it's almost creepy, like when you were giving the answer, because we know somebody that was just going through this with some back pain. And this person literally, like, it was just, was complaining about severe back pain. And then, like what you said, was thinking, oh my God, cancer, was thinking like kidney stones and everything. So they went to go get some scans done all around the abdominal area and the back, the spine, and the diagnosis came out arthritis in the spine.
Okay.
So I don't know if that was good. I mean, obviously, it's not
It was
cancer.
better than
Yeah,
it's better than those other two.
Yes, correct. So that's what but it's crazy because like the whole time this person just had that mentality of like the extreme case. So at times maybe that thought made that pain more real. The attention that the person was giving to that pain and what you said. So it's the mind remembering the pain.
Right. And it's 100% real. The more you think, sort of the same thing we do where people say, like, if you have a pain in your right hand and you hit your left hand and it's throbbing, your left hand now is throbbing, you think about it, your right hand hurts less. Or things like sometimes we have a pain somewhere and you put a heating pack, not necessarily for like it bringing blood and the nourishment and that side of it, but just because it's heating up the area and that hurts worse. And so now that pain is better for your brain than maybe the cut you have or whatever it may be. I wanted to add that when you decide to Google something as general as back pain, you could be specific, but also like where it hurts, or the more specific you are, the more specific answers you can get. Sometimes it's good, sometimes it's bad. But also for when you're going to talk to the doctor, the more information you know about yourself, I always try to tell patients to be sort of their own doctor in terms of be curious about what's happening with your body. Like you're the best person that knows yourself. Even the doctor could be following you for years, but like every Thursday morning my pinky hurts. The doctor might not believe me, but it might be true. And so just follow what's happening. So if you could just write down or just keep thought in your brain.
I was just going to say, I've been writing down like a list of like things that you want to.
Yeah, what makes it better? And the doctors always ask you the same thing. What makes it better? What makes it worse? When did it start? How long has it been? How long does it last? Things like that. The same questions they always ask you. Just keep those, because when you go to the doctor, then you're not wasting time. Sort of when you get one high blood pressure, or you get hypertension at one time, they tell you go for a month and see if you're having it every time. So measure it yourself at home. But if you came into the doctor prepared with all this information, then you don't waste some of your time.
Absolutely. Absolutely. Yeah. And talking about that, I was a health coach once, and we would help the older population try to follow up with their primaries. And which is something difficult to do, especially in the Latin community. Especially we have our abuelitos or papis that they're like having trouble going to the bathroom and for weeks, and they're like, I'm gonna be fine. But yeah, so so it is that what you said was I heard a doctor tell me that once a long time ago. Exactly what you said. No one knows your body more than yourself. It's so true.
Yeah, you got to be your own doctor, because if not, you're just relying on doctors, and then what you're telling them is what they're taking, but you might tell them three pieces of information. They have to run with that. And so the more you tell them, the more you know about yourself. You could be more in charge of your process.
So doctor, let's go to the next question. What is your advice for patients that are afraid to see the doctor? I mean, and then this is kind of links to what we were saying. My father-in-law is a great example of that. He does not like to follow up with the doctor, and he can be in severe pain.
Yeah, he's not necessarily afraid. He's kind of like,
he's like, no, I don't have nothing. The second I go to the doctor, I have this, I have that, I have that. So he's like, I don't want to go. I'm fine. So yeah, what do we tell them? Help us.
That goes a little with the other question about what people overlook, but we'll start with this one first.
Yes.
My thing is always find a doctor that you like. And that might, if you're actually afraid of all doctors, then that might be difficult. I'll say something else for that. But just find a doctor that you connect with. And that might be hard with insurances, switching from doctor to doctor. But if you're able to, even if you're just seeing them for a physical, you're like, oh, they don't like this one, you'll find another one. If you want one that's, speaks Spanish, or a male or a female, whatever it may be, like find one that you feel comfortable with. That would be the first part, because you want to talk to them about everything that's going on with her. They have
great advice
all the time. But the other thing for people who are actually afraid, I would say sort of exposure therapy. So if you're just afraid of needles, or if you're afraid of anything related to doctors, you can start by exposure therapy. Sort of gives you exactly what it says, exposures little by little until you can get to that big event. And so maybe like watching, I don't know, Grey's Anatomy or things on YouTube like Dr. Pimple Popper or something that
Oh my God,
Oh,
we
we
started-
love that show.
I started watching that.
Addicting.
So addicting. Yeah.
It is.
Yeah, but sort of watching those things and getting yourself like, okay, this doctor's not so bad, or you could see how they are with their patients, and then sort of working your way. Maybe you don't want to see a doctor, you decide to see a nurse, and you can see the nurse or the nurse practitioner if it's available in your office, and then work your way all the way to doctor. Even if it takes you a little bit, you finally get there. And then
so good.
And then nowadays, if you're actually afraid of like going to see, because they call it the white coat syndrome, right? Because a lot of people wear white coats, and as soon as like we're taking the blood pressure spikes.
The blood, this happens all the time. Yes,
all the time. And but the other thing that is great now is that you can do telemedicine. So they're doing everything sort of like we are now.
Audio.
You can call somebody, or you can text or chat with them, which I don't know so much. I know, especially a lot of the older folks don't want to see newer physicians. You're like, oh, you could be my great grandson or something. But sometimes they'll be willing to sit there and speak to you and see all your symptoms so that they can get to a place with you and sort of it's important to be in a team, not so much as the doctor's telling you, oh, this is what you have and this is what you're going to do, and you have no say. That's not what it's about. It's about, a team where he tells you, these are your options, sort of like he's working for you. These are your options, A, B, C. We think you have this. What do you think about them? And you tell them, oh, I don't like A. B plus C sounds good. Can we do this? And so it's more of a partnership that you're looking for than anything else. And if you can't find that, find somebody else.
That's a great way of explaining that, a partnership.
Yep. All right. So the next question, Dr. Santos, is what advice can you give someone that wants to attain optimal health? And I know this is broad, but just give us like a few things.
Like for example, I remember growing up, like it was a popular term, an apple a day keeps the doctor away. So what is that apple?
So we talked about a couple of things already. The one thing that apparently I'm bad at, drinking water, I would say is very important. There's thoughts about how much you need, and there's sort of semi-controversy on whether it's, people say half an ounce to an ounce per body, per pound a day, and that's sort of your maintenance. And then if you're doing more exercise, and drink more, drink water. But I would say just enough. If you're feeling thirsty, then your body's asking you for water, so just try to drink a little bit more and more. You can also get sort of drown in water, but usually you don't get there. So water is one of them. The second one, we talked about vegetables, eating more vegetables, which we all need to do. It's hard. They don't taste as great, but you give us a great recipe. So
you guys got to try it. I'm telling you, it's good stuff.
Going back to so I think water is like something like, I think for Hispanics, like they struggle with like I know, for instance, and I know I'm throwing my mom under the bus like, but like she does not like to drink water. Like it's so hard for her. Like she'll be like, I drank water today, and it's like, the little bottles, and it's like halfway, like the whole day. And I feel like it's something that you have to kind of train your body to drink water.
A cup of water a day keeps the
that.
doctor away.
Yeah, water. Yeah.
More than a cup.
A few cups of water a day. I think it's 8 cups a day. I think is the.
That's what they say. Yeah,
varies,
that's a lot of water.
It's a lot of water, but it really varies. I know it's
somebody like me, I can't drink like 8 glasses of water. Like, I mean, I drink a lot of water, but like not that much.
I think you do like 4.
Bottles.
I mean, one of the things, everyone loves talking about this subject, but one of the things that's very important that you'll notice if you don't drink enough water is that you can end up being constipated. And so that's one of the very, very, very important things. Everyone loves that topic. So that's one of the things that you can visually see. Maybe you've been having a lot of water, and maybe you do end up being constipated these couple of days, and you're like, oh, maybe I didn't drink enough water. Maybe you're drinking the same amount of water, but you went running, I don't know, 5 miles or something over it, and you didn't drink more water to compensate for the sweating or whatever it may be. And so that's one of the things. The other thing we talked about, besides exercising and all those things that I always say, like we were saying, just do it little by little. So whatever advice or whatever thing you want to try, decide I'm going to try, I don't know, let's say we're going to try the keto diet, or we're going to try the paleo or this other diet. Those are the 2 that always come to mind. But try it and start little by little. Take what you like, and whatever you don't like, go back to the other part and just take the bits and pieces that are working for you. And then not everything works for everyone. We're all different. We're all from different areas of the world. Our genetics are different. So maybe, I don't know, drinking or eating nuts and seeds is very good for you, Jorge, but for you, Adriana, like Ayman, you get drowsy. And it's those little symptoms like you're getting drowsy, you can't think as fast maybe, and that you realize what's working for you and what's not. But the only way you can tell what is and what's not is by doing the changes little by little.
Mm-hmm. Yeah.
Very good.
Good. Yeah.
All right.
Okay.
So our next question, doctor, how has the health field changed you since you were a kid?
That's a good question as well. I felt a little old when I read it. But in general, there was a couple things. I would say diversity, from the doctors that I was seeing when I was a kid and just seeing what was on TV. There's more diversity in ethnicities, and there's more women. It's balanced out as well. So that's one of the big things that has changed. Google.
Yes.
Google has made things easier in a way, and then harder as well, because your patients are looking up things and they're coming up with do I have this?
I don't know what people did before that, to Google symptoms. Did they I don't know. They just
I'm dealing with my daughter being getting wise, you can't just say anything now. She's like, let me verify.
Exactly.
And I'm like, no, we'll be there in 8 hours. No, we won't. It says 6 hours and 42 minutes.
Yeah.
Get your facts straight. Yeah.
Yeah. So.
But actually talking about one of the things that what the people do before Google, we were talking today with one of the attendings, and he was saying, when we want to contact the primary physician of a patient that's in the hospital or their nephrologist or whatever, they tell us the name and we Google it. We call them up. We don't think about it. He's like, what do you guys think we used to do before that? He's like, do you guys use 411 ever? We've heard of it, but never used it. He's like, yeah, we used to call 411. He's like, oh, this patient in Florida. And I'd be like, let's say for example, they're from up here and they're in Tampa, Florida. They call down the 411 and they tell them, there's this doctor, last name XYZ, and they could barely pronounce it. And they're like, the person's laughing at the other end because they can't really understand what's happening, but they end up finding it after a while and they give you, oh, this is our.
Yes.
And I was like, wow, that took so long and so much effort.
Yes.
We get it like this.
You guys don't know how good you have it, kids. You guys don't understand.
But yeah, other than that, patients are more involved, maybe because of Google as well. So that's good. I'd like to see that, like I said, sort of the partnership and the treatment. So I like that a lot more. There's new treatments. There's cell phones I can look up. If you have it in your hospital system, you can just be at patient's bedside and have whatever system you're using and look up their labs really quick. They ask you about a question, you just didn't see the labs, you look them up. Or you can talk to your patients through these apps as well. The telemedicine that's going on. What else? There's so many things.
Okay. Question number 9. What is a health area that is often overlooked?
I like this one too. I like all of them. One of them that always comes to mind is sleep apnea. So, or I guess that's specific health disease, but in general, your sleep as well. So we'll do it in general. So your sleep and whether that's affecting you mentally, if you're getting sadder, if you're getting depressed, if you're just, because the sun affects our hormone levels throughout the day. And if you're not getting the sun in the morning and you're one of those people, whether it be for work or whatever, that you're not getting the sun in the morning and you come back home and the sun is still not out and you never stepped out for lunch or anything, that's affecting your hormones. So that's one of the things people don't think about. Wow. But also with sleep apnea per se, a lot of people, whether they maybe, a lot of the time is because people are overweight. But even when it's not, people are snoring and maybe it might be a little more than normal. And they're just not sleeping well. They're waking up gasping for air and they're still like, I'm okay, turn over and sleep. And they spend years and years. And even when patients do get the BiPAP or the CPAP machine for their house, one of the things that I learned quickly in medical school was you ask the patient if they have it. I used to ask in surgery specifically, do you have a CPAP machine? And they would say yes. And the nurse came up to me. She's like, you don't ask if they have it. Everyone has one. He's like, you asked if they're using it. She's like, go ahead, go ask her.
True
And the answer was
story.
always no.
Oh wow, yes, that's very
Even
good.
I have family members that don't have it. Don't
I
use
mean,
it.
I got it. You never asked if I'm using it.
Exactly.
Wow, that is so true.
So that's a big one. And it affects so many things in your daily life. And so
Wow,
to
that is
use
so
it
true.
is
We
very
never
important.
thought about it, but as
Yeah.
soon as you brought it up, that is very popular. We know so many people that, I mean, especially in the world we live in today, with so many things happening around us.
Mhm.
You know, I mean, we have a family that we take care of. You know, we got our two kids, so there's a great responsibility on our shoulders. You know, to make sure
Yeah.
that we do the right decisions, that we make sure that we're proactive and you know, just cautious and smart about the decisions for the family. So it will keep you up at night.
Well, I was
Yeah.
doing a little bit of research, and I read that one of the health areas that's often overlooked is like mental health.
Yes, I was going to say, because Jorge was talking about, the stress keeping you up at night.
Yes.
And yes, stress is one of them, chronic stress specifically, that people have. And it's just affecting your daily life. It's affecting how you're thinking. And especially whether the stress is making you depressed or not. That's one of the most common ones that people are sort of subclinically depressed, or, you get sad and you just don't want to do the sort of normal things that you wanted to do. But one of the most important things, if you ever feel that you want to take your life, or in any sort of way, and just in a brief thought, it's important to find someone. But even before you get there, because that's sort of at the end of it,
Correct.
if you're just not feeling yourself, you're just feeling, you're just eating less, you notice different little patterns that are different throughout your day.
Mhm.
You want to reach out and talk to somebody, whether it be a family member that you can trust, or actually then talk to somebody who can help
Professional.
professionally. A psychiatrist, a psychologist, or even your primary nowadays. They can treat a lot of these
Absolutely.
diseases, and depression is one of the big ones that people don't talk about.
Sometimes, you know, for us, thank God, I feel that because we've experienced God's power in our life so much throughout our lives, it's been so much easier for me to get through over it like that. Because I promise you, I mean, as soon as that, it was overnight. As soon as that happened, now she's complaining I'm sleeping too much.
That's not true.
No. But I am sleeping great. You know, I lay
Right.
down and I go out. But you know, for those that are still struggling, I think it's not something to ignore. It's definitely something to, like you said, seek out some kind of resource, some advice, somebody that can help.
Right. Yeah, and at an early stage, like you noticed that was the first time, something like, if you believe in God, praying or listening to worship, or just listening to a preaching or whatever it may be. But something as simple as, well, like maybe you wake her up and like, hey, I'm gonna talk to you. Something,
Yes.
just telling them what's happening, just sort of venting helps, instead of sort of just keeping it in. And it's, if you kept it in once, you'll be okay. If you do it in that day after day after day, or something that's stressing you, and things you're not talking about, eventually it'll catch up to you.
Build up, yeah.
So we definitely did talk about it. I got a ride or die, so we were able to talk about it and get through it. So it was good. All right.
That's awesome. I want to say one last one for our population, at least, in the 20s and the 30s. We forget about hypertension, high blood pressure. A lot of times you get that high blood pressure, and it's a couple times you're like, it's okay, I'm fine, I'll be all right. But hypertension, they call it sometimes the silent killer, because your body gets used to it. If it's increasing over time, your body compensates for it. And so you don't get the symptoms necessarily. And then all of a sudden it's really, really high, or your heart is just not compensating enough, and you start getting symptoms, and it's usually not too late, but it's late enough where you're having a lot of complications. And so I know for our population, especially, I know my brother is one of them. He always has high blood pressure. Like, go get checked. You don't want to go get checked, but that's an important one. Exactly.
That's what, yeah, no. You know, and it is in my family history. My grandfather passed because of high blood pressure complications.
Okay, yeah.
Thank God, as far as my father and I and my mom, I don't think we've experienced that yet.
Good.
But
your dad changed his diet, didn't he?
My dad did. Oh, actually, you're right.
Like, he didn't want to take medication, so he like completely changed the way he was eating, and he's like fine now.
No, I think that's something to be proud of, because he was able to accomplish without having to go to medications or to go to that, what is that, dependency of insulin or whatever those levels are. He was able to go on a diet. He got to walk around the neighborhood with my mom. He's cut off sodas strictly and juices, straight water, no coffee. I mean, you know, he's also very disciplined. So now, nothing. I mean, he goes and his blood pressure is on point.
That's amazing. I like that. There's a lot of diseases here in the world, but in general in America as well, that could be stopped with diet, you know. Absolutely. Preventative, you know, high blood pressure, diabetes type 2 are some of the things that are killing us daily in our country, and a lot of them are preventative just for
So Dr. Santos, we want to thank you so much for your time. We have the last question, and I know this is a question that is in everybody's mind, especially right now. So we have our last question, and I know that everyone has been kind of, you know, waiting for this one because it's the topic of the time right now, and it's how has COVID changed your typical workday? You know, definitely you're our front line, and thank you so much, you know, for that amazing heart and to help people and to be there in these scary moments, risking your life. I mean, we don't know, you know, I mean, you know what we're dealing with necessarily, but you're there, whatever it is, good times, bad times. So thank you so much for being that front line. So yeah, could you please tell us how has COVID-19 changed your typical workday?
Yeah, for sure. And being there in the front lines and doing that work for everyone that has been doing it, especially since this started, is just what it's all about, sort of what we signed up for. It's just you don't expect it in such quantities, but hey, you got to be there. But yeah, and sort of in general, the first thing I noticed when I came back, because I was off when COVID started. So when I came back, I noticed straight off the bat, if you're going into most places, any clinics and the hospitals, they're just checking off your temperature. They're giving you a mask, wash your hands. Do you have any of these symptoms, right?
Yes.
So that's the first thing. It's just stopping your day. But it's important, you know, to try to keep everyone healthy and you know, minimize the exposure as much as you can. And then with that, in a typical workday, the hospitals are much quieter. Usually I was used to a hospital having sort of be buzzing with people, with visitors and with mainly with visitors. You know, with people running around, you still have the nurses and the attendants, everyone running around, but it's just sort of dead. At least here in North Carolina, I believe we're still in phase 2. And so at least for what that means for the hospital is that now they're allowing visitors to come in, but it has to be close family members. So like your wife, or maybe a kid, and it's just like one immediate. Maybe. Right. And so you're not seeing like the sisters and all the kids coming in. They're not allowing that. So you're not sort of getting that buzz. And for me, having, you know, Latin patients and seeing them, it's a big change because now a lot of patients are getting sad, you know, maybe not fully getting depressed, but they're really getting sad and sort of getting down and just want to go home. They don't want to be there because they can't see anybody, you know. Wow. And so that's one of the big things. You know, wearing masks and not being able to hear people has been a major one. Have to enunciate and speak louder.
We were dealing with that today in the grocery store because we were trying to talk to the lady at the register, but we both have masks on, and she has a shield, and she's like, "What is that?" I'm
I'm yelling.
Exactly. You just gotta talk over it, like, and then if you take it off, they just look at you weird because
correct.
I can't do it. Yeah, I mean, it's overall, I think in most hospitals, as much as they can, they're specialized units. So if you're not in there, you're hopefully not getting exposed as much. So they're trying to limit who is in there, and you know, when they're coming out, they're taking off their, you know, changing clothes, making sure they leave as much as that in the hospital and being washed as possible. But and sort of in general, people being afraid. So for the most part, right at the beginning, a lot of hospitals were not at the verge of shutting down, but they were losing a lot of money just because they weren't having people come in. And it takes a lot of money to run a hospital, and people were just afraid to come in. And so patients would come in sort of at their wits' end. So they knew they had this pain or whatever it may be, and they waited out until it was so bad they couldn't tolerate one more second of it. And then at that point, it's pretty extreme, you know, so you have to do so many more things than you could have if you sort of prevented it or caught it early. And so that's one of the things that, especially a month ago, was still being seen, and still now, is people are still afraid to come into the hospital.
Correct.
and you know, it makes sense in a way, but most hospitals are being very cautious. But yeah, so that's one of the things, people being afraid to come in. But it's important, if you have some of those symptoms, you just even call your PCP and ask them before, do I need to go to the emergency? Might be even a good step than just staying at home hiding with these symptoms until it's too bad. But one good thing that sort of has come out, at least I think it's a good thing, is that people are more hyper aware to wash their hands. And especially doctors, I want to say, and you know, everyone working in the hospital, I want to say that 100% of the time you wash your hands as you're going into the patient room and out of it. But for the people that weren't as conscious about it, sure, now they really are. Yes. Instead of getting the hand sanitizer, sometimes they're even going in there washing their hands. Actually, so that's one good thing that has come out of this.
No, absolutely. And you know, this is something that we, you know, like everybody out there, has changed our lives. Absolutely. Yeah. But I will say that we have been able to see, like they say, the cup half full. We've experienced a lot of great memories. You know, we're around our kids a lot more. You know, we work at home, both of us, so we're like together a lot more. We definitely, you can even tell the relationship with our kids, like they love the grandparents, and they, at some point, it almost looked like they love Papa Pastor a little more, you know, than me. I was getting a little jealous, but now it's like you can even tell he's just like so Papi and Mommy, because you know, we're spending so much time together. We've been doing work in the house. I'm not too excited about that, but
Adriana is though, I'm sure.
Yes. But there's definitely been a lot more conversation around the house. We're cooking a lot more. So I think that's been a lot. Like, we're trying new recipes, eating healthier, because you know, working outside also sometimes with the schedule of so many things to do, you just got to grab and go, and it's usually never healthy.
Right.
But being at home, you know, we've been able to do some home cooked meals, and so, and in our part, you know, I'd say, yeah, we stayed healthy, and you know, we're doing Cafe Negro Show. This has been a product of, you know, the whole pandemic that we've been going through, you know, just to kind of stay active, and you know.
Exactly. Yeah, and people being stuck inside sort of gets their creative juices flowing. The memes out there are crazy just because people have time to do things now, which is really nice. It is a big plus.
So, Doctor, we want to thank you so much for your time. Thank you so much for joining us here at Cafe Negro Show.
Yes, I love it.
Sure.
Before, is there anything you'd like to announce, or is there, like, if people had any questions, like, how can we, you know?
I guess.
I mean, we don't want people calling you or bombarding you. I know that would be too much, but you know, or any last words for us?
I mean, if they have any questions, I don't know if you guys like have comments, but I can go through them.
Yes.
Just, I think we've said it a couple of times today, but just don't feel bad to ask for help, and anything as little as it may be, to catching it early. And being proactive about things that are going on is very important, especially, you know, in the typical medicine field, but especially in the mental field. And during this time that people, the great time that we have been spending at home with our families, but the other side, that there's some family members that just don't get along, and things are happening at home that are not ideal. So just keep in mind there are places you can reach out to, or just going to talk to your primary care physician, and they can tell you the resources that are in your town that can help you with that. So yeah, thank you for having me. It's been a pleasure.
Thank you so much. Again, Dr. Santos, please, everyone, like she said, if you can leave your comments, she'll take a look at them, and then maybe we can answer back with, you know, some good advice. Sure. Or if you have some more questions, or you want us to do another episode on some other questions you may have, just leave us a comment, share, like, comment. Once again, Dr. Santos, thank you so much for your time.